Hi, everybody. This is week 3 of Nursing 423 Global Health and Health Policy. Today's topic is all about culture and health, and we'll discuss the healthcare needs of immigrants. I'm going to keep these videos very short, but I am going to give you some supplemental materials from folks who are more expert in things than I am, because I think that their perspective will enlighten you. But I will cover the basics here. So by the end of this module, learners should be able to define culture, cultural competence, and be able to differentiate that concept from cultural humility. You should be able to describe the conceptual relationship between culture and health and review some specific examples of the influence of culture on health behaviors and the influence of culture on the design of public health interventions. You should be able to describe the barriers to good health for migrants and understand a little bit about the debate in the United States about immigrant health. So let's start with a vignette. This comes courtesy of Richard Skolnick from Yale University. He wrote a textbook, Global Health 101, if you're interested in finding out more. Dorji is a man from Bhutan. Lately, Dorji has been feeling tired and weak and just not himself. He has low appetite. So he tries to self-treat for about a week. And when his symptoms don't improve, he decides to go to the clinic where, in Bhutan, clinics are divided into both indigenous healers and Western medicine. It's a combined model to be culturally responsive. So Dorji sees the indigenous healer and he describes his symptoms. The healer prescribes him some herbs, but really thinks that probably what Dorji has is a low-grade infection and would benefit from seeing the other practitioner. And so he does refer him across the hall. Dorji sees the doctor, gets a prescription for antibiotics, and recovers. And that's an example of how we can combine cultural sensitivity with appropriate care when people need to access it. So let's start by defining culture. Behavior and beliefs that are learned and shared, that's the simplest definition of culture. But of course, it's much broader than that. It operates in many domains. It is pervasive and probably the biggest influence on human behavior. It influences family structure, family behaviors, traditions, and rites of passage. So think about some of the things we see in healthcare. We see childbirth and pregnancy, both rites of passage. We see death and we see illness. Sometimes we see the growth and development of children. Those things are all dictated, the behaviors around those stages are all dictated by culture. Patterns of communication are affected by culture, both verbal and nonverbal. If you were to study different types of communication styles, you might note that some cultures don't give direct eye contact because they think that's disrespectful. In some cultures, shaking the head back side to side means yes, whereas in other cultures, that same body language means no. So be aware that culture does influence patterns of communication. If you're not understanding how someone is communicating something to you, then maybe you should consider culture. Of course, culture and religion are very interconnected in most cases. Culture also influences art, music, and literature. Politics and the economy often have like a reciprocal relationship with culture, where economic conditions sometimes dictate longstanding patterns of behavior, and political conditions can dictate cultural phenomena. But culture has a deeper impact on politics and the economy. Foodways and health behaviors, and these are very resistant to change in most cases. It's very difficult to get people to give up the foods they grew up with or to reconsider some of their conceptions of health and illness. And sometimes we don't necessarily have to do that. We can adapt our practices. Other times you'll find that health behaviors in a given culture are harmful and need to be corrected to reduce the global burden of disease. Of course, cultures mark rites of passage and shared historical events with rituals and celebrations. And when these are important in healthcare, sometimes there are rituals surrounding death, preparing the body. Sometimes there are rituals surrounding birth, and these should be respected unless there is some good scientific reason not to. So, when we talk about cultural competence, just be careful. It's not something that you're ever done with. You don't take a course or read a book and suddenly you're culturally competent. You check the box. It is a growing ability to interact with people of different cultures, and it takes into account many different skills. It's a skill set. So, general respectful attitude towards other human beings, interpersonal communication skills, um, very important. Emotional intelligence. You have to be able to read when you're not getting through to people or when you're making them anxious by your behaviors or your statements. So try to put yourself in another person's shoes. At the same time, you need to be conscious of the health beliefs, practices, communication styles of other cultures and be responsive to things that are important to that person culturally, and also make sure you're communicating in a language that they understand. That's really important. Um, a lot of times we try to get by with gestures, or we talk really loud, or we use family members to communicate medical information, when really we should be using a certified medical interpreter to really meet that person's needs. Now, cultural humility is something a lot deeper. It's an extension of cultural competence, but it's really an inward process. This is a lifelong reflection on your own beliefs and values, your own cultural identity, and your views when somebody comes in and their culture is not what you're familiar with, and that dissonance. So you have to examine your personal biases. Now, biases can be explicit, meaning that we're aware of them and we state them to others. You will occasionally come up against this in healthcare, maybe more than occasionally, depending on your practice, where people will make statements that are stereotyped based on a person's culture. And, it's sort of everybody's responsibility to look at those biases and see how they impact care. The more dangerous phenomena is implicit bias. These are the biases that we are not aware of, and we don't necessarily verbalize them to other people, but they do impact the care that we give. So, for example, if my implicit bias is that I feel that older people don't feel pain the way I do, they just complain more, I won't treat that pain the same way. So I have to examine my thoughts and my attitudes when they come into conflict with what I think a patient needs. And I'm always looking at those, and you should too. And your views on the cultural practices of others. Sometimes something that we don't understand could be actually beneficial to that person, mentally, physically, or spiritually, but because it's not what we've been told. Healthcare has its own culture, by the way, and many times it conflicts with the cultural practices of others. So sometimes we need to rethink that. Okay. And I'm going to cut this off here and we'll start again in a minute with the impact of culture on health.